You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of cosmetic dentistry. With us, we have a cosmetic dentist, Salt Lake's hottest cosmetic dentist, Dr. Austin. Dr. Austin, welcome to the program.
Thanks, Randy. Glad to be
Now,
here.
you brought a lot of photos.
I did.
So we'll have time for some of those. Before we get into today's topic, tell me a little bit about your background, your training, and your center.
I graduated from Georgetown Dental School and then have had an interest in cosmetic dentistry ever since I got out of dental school, and have sought after the best type of cosmetic training afterwards. Graduated from really the only cosmetic dental institute that has a worldwide renowned reputation.
That's LVI, right?
Yes.
Las Vegas Institute.
Yes.
Okay.
And have focused my practice on cosmetic restoration for years and years.
Okay.
I started out with just using bonding material, which was the only material that we had available to do tooth straightening and tooth whitening and giving people new smiles.
What are the different categories, then, of cosmetic patients that you see?
Well, we have tooth whitening or bleaching, which is commonly used. There's products on the market that do some of that over the counter, but there's also some power bleaching procedures that we do in our office that people come in and can get their teeth.
Is that very popular?
It's quite popular. It is. It doesn't solve all the problems all the time, and there's some rebound effect as time goes on that the teeth discolor again, and so you have to keep up on top of that. But for some people, that works quite well. And
veneers, hot topic.
Veneers is the most permanent type of resolution for really making your teeth cosmetically pleasing, giving a new smile, and straightening teeth that are crooked or misshaped, or if there are spaces. It's amazing what can be done with cosmetic porcelain veneers.
And who is the typical patient, by the way? Is it men, women?
It ranges.
Just people that don't like their smile? What is it?
Yeah, you know, there's a ton of people out there that just don't like the way their teeth look and don't like their smile. And so most commonly is that they want their teeth whiter and they want them straight. And that can range in age from teenage years to people in their 80s and 90s. I mean, they lived their whole life and it's just like, time's come, I want my teeth straight, I'm tired of looking at these ugly teeth, and I want a new smile. Okay.
Now, I always feel that I can spot veneers, 10, 20 yards away, big, giant.
Here's the thing on this, Randy. If you can tell people have veneers on, you know what? They didn't get them done correctly.
All right.
I mean, I'm being quite...
It's in the hands of the dentist, then.
It is the hands of the dentist, and most particularly in the hands of the ceramist who actually makes the porcelain. There's an art to making teeth look natural.
Okay.
And this is where that person plays a key role, and also what the patient, what the person that wants the new teeth to look like, what they have in their mind, also plays a key role into making people feel comfortable with their new smile.
Okay. Now, with this ceramicist, you say, very important. So he makes the teeth, and he's right there in your office.
He is.
Not always the case?
Not always the case. It's unique to have the ceramist in the office that is actually doing the procedure.
And what's good about that?
Well, here's the thing. What normally happens is somebody takes an impression, you send it to Timbuktu. I mean, who knows where you send it? You know?
All right.
And then it comes back in a box, and the dentist opens the box, and there's no communication really. You write a little slip and say, we want to, let's try this shade, or let's move this tooth this direction, and then it comes back, and it is what it is when you pull it out of the box.
Okay.
And so you take the boxed up veneers and you put them in the patient's mouth, and you say, this looks good, doesn't it?
Okay.
And you know, the problem with that is that if you need to make some changes, which most certainly you do, as you go down this road of getting a perfect smile for the patient to be happy, is that you need to tweak this. You need to analyze this to make the teeth look natural, to make the smile fit the person's face and personality. And it's really an art to do that.
How much say-so does a patient have, though, in their smile? Okay, so they go into you.
We do, here's what happens. We take impressions of where they are right now. And then we actually do a mock-up of how the teeth are going to look, where we're heading with the permanent veneers and the permanent smile. And we use that mock-up model for the patient to wear their temporary veneers while the real ones are being made. So they get a sense and a feel for what we're thinking looks good on them. And if they want to make any changes, we have them come back in and we say, look, do they feel all right? Do you need them longer? we think this looks good. What do you think? And they have complete say.
Do they normally say, I love it, though, by the way?
We get them to that point. If they're unhappy, we make sure we make the contour changes, and then we take a new impression and we make the teeth exactly the way they like them. That way, when they walk out the door, they know what they're getting. It's not like other, frankly, other cosmetic procedures that are done. You look around and you look in all the pictures of all the people that do these cosmetic procedures, and frankly, what you do is you hope that what they are going to give you is what you're going to like. Not so with us, because you are able to see.
So you try them in.
You try them in. You're able to see exactly what you're getting, and
that's good. Because that would be my fear. What's it going to look like?
There's a process of approval. We work as a team together, so the patient absolutely has complete input on how this is all going to turn out.
So what makes up a good smile? I mean, in your eyes, okay.
Well,
what makes up a good smile?
You know what? Here's the thing that makes a good smile. You have to have the teeth look natural. You have some translucency on the edges of your teeth so that they don't look opaque. They don't look like chiclets. They don't look, and frankly, there's veneer materials out there that are opaque, that have no characterization in them.
I mean, just one flat color.
One flat color,
top to bottom.
Mono.
Like these machines that make
monochromatic.
Teeth.
Yeah, exactly. And they're all made out of the same material, so that there's no layering.
Oh, is that right? Okay.
Yeah, there's no different type of porcelain that's used, and this is all done by the ceramist by hand. And it takes time to do this. I mean, in order to do this right, it takes time for the ceramist to make each individual tooth fit the whole smile profile. The teeth have to follow the lower lip line. You want to feel the space in between where the corner of the smiles are. I got pictures.
Let's take a look. What are we looking at here?
Here's a very interesting case. This lady just wanted wider and wider teeth. She kept bleaching and bleaching and bleaching. Never really got the result that she really wanted.
Okay.
Well, the fact of the matter is that her teeth were too short. The discoloration of her fillings and her crown.
So when you look at this, because it looks like a pretty nice smile, what do you see?
Well, I see that
you could improve.
There's the teeth are flat on the
front
edges.
too.
Yeah.
Okay.
You lose some femininity there. You have some masculinity enter in when your teeth have worn down and are flat. They're not contoured correctly. The front teeth are exactly the same length as the lateral incisors.
On the right side of the smile,
yeah.
Okay.
On the other side, it's just misshapen here. And you don't have a natural contour from one edge of the smile to the next. And there's really no translucency. She's bleached her teeth.
So when you see this person, do you think, wow, this is going to be great? Great result.
Yeah.
I mean, is that the way your mind works?
Yeah,
when you're...
I look at it and I think, you're going to love what I can do for you.
Okay.
And people do. They come back and say, I wish I would have done this years ago.
So in her case, what did you do?
Well, we prepared the teeth. We took off the old dentistry, the old porcelain to metal crown. See how opaque that one tooth is on
the left, on the far left of the smile? Okay.
Yes. And what we did is we replaced them with nice translucent porcelain veneers.
Wow, very nice.
So
that's a sexy smile.
It is.
Very nice.
And it's not the type of smile when somebody walks in the room, you look at her and think, wow, where did she get her teeth done?
Can a dentist at first glance even notice that? Because at the bottom, they're see-through a little bit?
Yeah, that's the whole idea of having something look natural. Like I say, people that have had this done correctly by someone who really knows how to do it, and that includes the ceramist, and it includes participation on the patient and input from the patient. People that have had this done correctly, you can't tell that they've had it done. You just think, what a nice, healthy, bright smile.
Now, we've had you on the show talking about dental implants. You say that people that are in dentures, you give them dental implants, their teeth back, change their life. What about somebody you change their smile? Big boost in self-esteem?
It's a huge boost in their self-esteem. People walking around thinking, I have a crummy smile. And every time they see someone that has a great smile, they wish they had that.
Is that what they tell you?
Yeah, that's what they say. They come to me and say, you know what, I just don't feel that great about it. I had a young man just the other day. He just looked at me and said, I'm getting a new job. I want to get veneers on my teeth because my smile, I feel like I'm so embarrassed by it. It changes my behavior in my presentations. I'm going to do some sales work.
Okay.
And it just inhibits me. I just want to get it done.
Well, there is credibility. When you look at somebody, they have a great smile, and I was doing some thought on this over the weekend because I know I'm interviewing you today. And when you see somebody with a great smile, they look squared away, they look healthy, they look successful.
Yeah.
Now, you have photos.
I do.
What else are we looking at here?
Well, we've got some, these are just people that are aftershocks.
They look like models.
Yeah, they look like models, but they're my patients. We send them to this professional photographer and we ask them, how would you like to have your photograph taken by a professional with your new smile? They love it.
Yeah,
so
very nice.
People come in and they have their new smiles. And you know, if you look at these, Randy, each smile is a little different.
Yeah.
They're not all the same. It's not a cookie cutter thing. And that's where the expertise comes in, where the ceramist and the patient and I work together in order to get a smile that fits their face, that fits their opening. You know, when you smile, you have an opening.
All right.
And that opening, how the teeth line up in that opening is a very key thing to having the smile look natural.
Interesting. Okay.
Yeah. And so there's dimensional changes. We take digital photographs. We make all of these measurements.
Are you a perfectionist?
I think I am. You know what? It drives me crazy when things aren't perfect.
All right.
And so we make sure that everything fits correctly and that it functions correctly and that the patients are happy. That's the bottom line.
Now this woman over here, and these are veneers. These are all veneers because they
These
look
are all
natural.
veneers.
I mean, when I
and
look
you
at
notice they're different shades too. You know, people have desires for different shades.
beautiful, beautiful teeth.
Yeah, she loved
It
those
matches,
teeth.
like you said. It follows that
They
lip
just
line.
flow in. This young man is in cells, and actually after he got this photograph taken, there's a large company in Utah that sells suits. And so they said, you know what, we want you to be our model for our suits.
Okay.
And so that's what he did. And so he called me back up and he said, my new smile has made me a kind of a part-time model. So that was a fun thing.
Okay.
It was a great thing.
Who's this happy
This is a great
woman?
lady. This is a lady from
Now that.
that we did a full mouth reconstruction on. She had.
What does that mean, full mouth reconstruction?
It means that every single tooth in her mouth had decay, had problems with it, and cosmetically was just not right. And look how beautiful of a woman she is.
Yeah.
Think of
It's hard to believe that she ever had a.
Think of her not having a great smile, and so she.
She a model?
Yes.
Oh, she is a model.
And she's also a physician. She's from Eastern Europe, and has done a lot of modeling work, and she's just a great lady. So.
So, you know, I mean, are you getting regular people? That I mean, is this just?
You know, it's an interesting thing. People have the same need universally, and that is to feel good about themselves, to feel like they're at their best, and those feelings come from people that are Hollywood movie stars and models, like a couple of these people, but also regular people just want to have a nice, healthy smile too. And so we get.
What if you don't like going to the
spectrums.
dentist? I mean,
Nobody
pain,
likes going
things
to
like
the
that.
dentist. Who likes going to the dentist? Nobody does. The way that we solve that, it's fear. It's fear of, you know, I want a new smile and I want to do this and I've saved up my money to get this taken care of. It's a goal of mine, but now who do I go to make it so that I can know that I'm going to get a result that I want,
Okay.
but also go through the process without having a lot of pain. I mean, it's a big deal. The word pain is a huge factor with dentists. People tell me all the time, I'd rather be here, I'd rather be anywhere else but in your chair right now. This is where, they say this all the time. This is where we use this sedation, where we take and give people some safe medications, some Valium-like medications that help them relax, and they don't even remember the visit. Most people don't even recall it. I go in the next day and say, so do you remember?
They're brushing their hair the next day, and they're going, why do I look so good today?
They kind of wake up with their new smile, you know, is what happens. And they come back and say, I don't even kind of remember you from yesterday.
Do they really say that?
Yeah, they do.
It's hard to believe.
Yeah, and it's a very comfortable, safe way to have dentistry done, have veneer work done, so that we have checked off that box. In fact, we've X'd it out.
How long does it take? Somebody watching this, I mean, a typical scenario.
Oh, you do 6.
Go in.
Yeah, we take impressions the first day.
Like a month turnaround time?
Oh, no. Sometimes with our ceramist, if we know people have special needs, and people that are, sometimes they'll fly in, they'll call us from the airport and say, I want to get my teeth done. Can you do it? How fast can you turn it around? Sometimes we can turn it around in 2 or 3 days.
Oh, really?
Yeah. You know, one time we did it in a day and a half.
So now everybody that calls, by the way, that sees this, they're going to say, I want it in 3 days.
Well, you know what?
So
If we have reserved time and we
it.
know when they're coming, we can turn them around in 3 days.
Okay. So change your smile, change your life. I mean, is that
Yeah, that's
you
what
see
it
that?
is.
You see people
all the time.
just because
people
of their
just
teeth?
tell me.
Just because of their teeth?
You know what, Randy? It's more than just teeth. It's something about a person's, their personal persona, their feeling about themselves, their whole image of themselves is here in their mind. And if something as important as their teeth that they've hated for so long that they resent almost, if that gets corrected and that becomes pleasing to them,
wow.
You know what happens to them? They change their personality. They change.
You see those changes?
Outgoing. They become outgoing. They become successful. They change the way they dress. It's remarkable. People come in, we do their teeth. We have them come back to have their teeth cleaned in 6 months. How do you like your teeth? I love them.
Well, it sounds like this is a dentist talking, though.
Yeah, I am one. Yeah.
No, but when you see these patients, I mean, you really see these kind of transformations?
People that are at my front desk, they'll say, come take a look at Julie out here since we did her teeth. And she'll be decked out and look beautiful. Since we're talking about changing lives, let me tell you about one experience I had that it not only changed this person's life, but it changed mine professionally. I had a couple, they brought in a young man. They didn't even know how old he was. They had gone down to Mexico to an orphanage. And in the orphanage, they were kind of looking and considering some adoption situations. They saw in the orphanage over in the corner this young man, and no birth date, no parents, they had no idea, had some other physical difficulties with his arms, his hands, and his feet. And part of the problem genetically was that his teeth did not form properly, nor did his jaws form properly. They went over to this young man, and he was sitting in the corner, and he was hoarding bread in his coat. So he had all of this bread.
Why was he doing that?
Because he didn't have, his teeth were not aligned enough to chew food. The only food he could chew and swallow was bread.
Wow.
So every time he got close to where some bread was, he would hoard the bread in order to survive.
Okay.
This wonderful couple took this young man and adopted him, brought him in.
Wow, good.
Brought him into their home, did some surgeries on his feet and his hands so that he could become somewhat functional. And then the next step was, we got to get him so he can eat properly. And so they brought him to me, and we started out with that photo. The only teeth that would touch are in the very back, just the 2 molars in the very back, because his
front
jaws...
teeth wouldn't even close?
That is closed for him.
Oh, that is closed?
That is closed. He couldn't incise food. You know, you think about, what if you couldn't bite into things and break them off so you can chew them in the back of your mouth? The only thing that you could really eat would be bread.
Just shoving it back there.
Shoving it back and let the bread just kind of gum and chew the bread on those 2 teeth.
When you saw this, by the way, was this one of those you knew you can take care of right away, or you thought, I'm going to have to look at x-rays, or you knew right away?
I'll tell you what, I honestly looked at that and thought, this would be a big challenge for me, but I think I can help him. So we did our routine. We went through, took all the x-rays, we took impressions, we saw his bite, his occlusion, and how off it was. Can we bring those teeth together without doing major surgery, just using this technique of using this porcelain? And the answer was yes. We waxed it up, we did the mock-up, and then we were able to place those teeth. We did this in 2 visits.
And those are veneers?
Those are veneers. Those are porcelain. That's all porcelain work.
So he's able to eat, function.
The first thing he did when he looked at his teeth, and his parents were right there, it was an emotional time, is he said, Mom and Dad, I want to go to McDonald's and get a hamburger.
Really?
So he could chew into a hamburger. That's the first thing that he wanted to do. I want to get a McDonald's hamburger.
That's amazing.
So we've seen him several times since, and it's been a gratifying experience for me professionally and dentally, and for our staff, and to be able to restore a person like this.
So one level or another, a lot of people live like this, where their teeth really bother them, and it holds them back in one way or another. I mean, this is extreme, and good for you. That's a great story. So final message, though, to anyone watching this. They don't like their smile. You can do something about it. And you can do it affordably. You can work your way through that. There's lots of different options, and it is something that you can take care of in a pain-free environment these days with these types of materials and the different types of implants and different types of porcelains that are available. You know what? Dentistry has come a long ways, and it's a great time to be a dentist. All right, I want to thank you for coming on the show. Very interesting. Always a pleasure. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez.
Thanks for watching The Wellness Hour. the leader in medical news with your host, Randy Alvarez, the authority on health issues.